As a member of the Health Liaison Committee, I assume everybody can hear. I welcome you and am pleased to introduce Dr. Patricia Tsang, who will talk about integrating Western medicine and traditional Chinese medicine. Dr. Tsang was born in Hong Kong and grew up in San Francisco and got her medical degree from UCSF in 1963. She became interested in traditional Chinese medicine when, as a third-year medical student, she contracted pneumonia, followed by a cough that would not go away, that was not helped by drugs, but finally cured by Chinese herbs. Dr. Tsang decided to learn more about Chinese herbs and acupuncture and did so at the American College of Traditional Chinese Medicine. And from 1989 to 1999, her medical practice integrated Chinese and Western approaches to health. She wrote a book in 2008 called Optimal Healing, a guide to traditional Chinese medicine, which will be for sale for those of you who wish to purchase it afterwards. Her talk this afternoon focuses on learning to tell when traditional Chinese medicine may be right for your condition and how to make sense of what a traditional Chinese medicine practitioner may tell you. Please welcome Dr. Tsang. Thank you. Is it working? Okay. Here? I'm going to discuss the differences between Western and Eastern medicine. Statistics tell us about 36% of Americans use complementary alternative medicine. Now, you might wonder, why is that when we have such great advances in Western medicine? Well, if you ask a patient who seeks alternative medicine, they will tell you Western medicine can't treat certain conditions. If you ask a skeptical mainstream Western doctor, they will say those patients weren't very sick anyway. And maybe it's the attention the Chinese practitioner gave them, feel good, so they feel like they got better. Placebo effect. But actually, the Eastern and the Western approach are very different. And they're different because they're influenced by philosophy. I'm going to cover Chinese medicine. It's derived from the philosophy of Taoism. Have you ever noticed when when you look at a Chinese landscape painting, the human figures are depicted as very small. This is because of the philosophy of Taoism. Taoism teaches that the universe has a certain order, and it's dependent on the balance of opposite forces. An example might be the atom, where you have positive and negative electrons, protons. If they are balanced, everything's fine.
but if they get out of balance, you have a nuclear explosion. And the Taoist philosophy says that it is incumbent on man to live in harmony with that order of the universe. And if something goes wrong, it's because man has somehow disrupted that order. So what are some yin and yang, the concept, has to do with the description of the sunny and the shady side of a mountain. Yang side is light, warm, and dry. The yin side is dark, cool, and moist. Now, there are some yin and yang forces in medicine. I'll just give a few examples. For instance, you've all heard of adrenaline rush, right? The hormone that takes effect when you're facing an impending danger, fight or flight, and your pupils dilate, your heart beats faster and stronger, and more blood flows to your brain and your muscles, so you could either fight or you could flee. Would you say that was a yin or a yang force? Yang, that's right. Okay, and then the other scenario would be you've just had dinner and you're lying on the couch watching TV, and your heart slows down, and your pupils are no longer dilated, and all the blood flows to your intestines. And so this would be the opposite, the yin force. And then let's say you did some gardening on the weekend, maybe for too long, and the next day you woke up and your wrist is red, hot, and painful. You have a tendonitis, inflammation. Would that be a yin or a yang force? Yang, right. And then the opposite would be yin, anti-inflammation. And then another example is you've all heard of bipolar disorder, and people who have depression, they usually have no energy, they don't feel like doing anything, they don't want to talk, they don't want to eat. So would you say that was a yin or a yang type of reaction? Yin, yeah, that's right. And so the opposite, mania, where the person has too much energy, talks too much, does too much, that would be a yang, the opposite force. Okay, because of the philosophy of Taoism, the Eastern approach is non-invasive, because man is not supposed to disrupt the harmony of the universe. So the Eastern approach is definitely non-invasive. And so they use pulse diagnosis and tongue diagnosis. And then I will discuss the two other principles of the Eastern approach. First, pulse diagnosis. If you go to a Chinese practitioner, chances are he or she will use 3 fingers and put it on your wrist to feel for the radial pulse. What is he feeling for? As you probably know, the heart pumps blood to the main artery of the body, which is the aorta. And from that main artery, there are branches that go to the upper zone, to the head area of your body. There is blood, the branches that go to the middle zone, and other branches go to the lower zone. Actually, what the Chinese doctor is feeling with those 3 fingers is the difference in the quality of the pulse in those 3 zones. it's usually very sensitive. Sometimes the doctor can detect things before they happen. One example would be a pregnancy before the pregnancy test turns positive, because there's a difference in how the blood volume changes and the pulse qualitatively feels different. However, for most of the time, the Chinese doctor knows which zone of the body has a problem, but not necessarily specifically what the problem is. So this a form of diagnosis, high sensitivity, low specificity. And then if you have a digestive problem, most of the time, if you go to a Western doctor, sooner or later you will probably get an endoscopic exam where they look up and down, see what's wrong. But because of the influence of Taoism, the Chinese doctor does not invade the body. So what does he do? He looks at the tongue as a representation of the internal organs of the body. And he looks for the size, the color, the texture, and the coating. And from that, he can detect kind of what's wrong. But again, it's not specific. Now, in Chinese medicine, they would say that a person gets sick and the beginning of the sickness is some imbalance of the yin and yang forces of the body. And the Chinese call this the bun or the root. And the character for it is actually a tree, and its root is sticking under the ground. And the Chinese doctor would say, if you treat only the external manifestation of a problem and you do not address the root problem, the patient might get somewhat better, but not completely better. I'll give you an example. I had a patient, 30 years old. She gave birth to her second child. Shortly after that, she went back to work. And she developed a rash. And the rash was itchy. She saw a dermatologist who prescribed some steroid cream. And when she applied the cream, the rash would disappear and get better. But if she stopped, the rash came back. And then after a length of time with this experience, she decided to try Chinese herbs. So I put together a formula for her that what I thought was the root, the bun problem, which is that after her delivery of her baby, she had not adequate time to rest. And usually in Chinese medicine, it is felt that after delivering a baby, the two systems that are weakened are the blood system, because it involves blood loss, and also what they call kidney qi, which is actually the hormonal or endocrine system. So her prescription addressed those two deficiencies, and after a while, her rash disappeared, and she no longer needed the steroid cream. The Chinese doctor would explain this patient's response this way. The rash was actually an external manifestation of the root problem, which was kidney and blood qi deficiency. Another principle of Chinese medicine is what I label economics of energy. We all know that there's a limitation to how much energy we have. And like with electric grid, if too many people use their air conditioning all at once, the demand might exceed the supply and you have a brownout or a blackout. Well, the Chinese doctor believes that's true of the human body too. You just have a limited amount of energy to make all your organs function. But if there's added stress, maybe emotional stress, overwork, fatigue, trauma, the energy might not be enough to go around. And then the weakest organ or organ system starts to fail. And I have an example, which I love to tell, of this patient who was 40 years old. And she came to me because she had some digestive problems. And the Western drugs were not helping. So I treated her for a period of time with Chinese herbs. And her digestive problems went away. And then one day, at her follow-up visit, I noticed she looked prettier. She had a glow on her face. And then she told me she missed her period. And I asked her, could you be pregnant? And she said she and her husband had been married for 20 years, never used contraception, and she never conceived. So I did a pregnancy test on her, and sure enough, she's pregnant. And she delivered a beautiful baby boy, and every Christmas I would get a box of See's candy from her. Now, the Chinese doctor would explain this patient's response this way. She had two weak systems, her digestive system and her reproductive system. And because she had the digestive system, which demanded a lot of energy, there just was not enough energy to go around for her reproductive system. But when I treated her for her digestive problem, then it kind of freed up more energy, and it went to her reproductive system, and that's why she conceived. Now I'm going to talk about the Western approach. We can attribute the Western medical approach to the philosopher named René Descartes. He lived in the 17th century, and then I think he was part of the Western philosophy of rationalism. He is the one that said, I think, therefore I am. And according to Descartes, the human being is made up of two clocks. One was the body clock. And if somebody gets sick, Descartes says what you need to do is open up the body clock, try to find the defective part, fix it or replace it, and it should work fine. However, if you can't find it, what's wrong in the body clock, then it must be in the mind clock, and they're separate, and there's nothing to do. I figure probably some of you have experienced this, or someone you know has experienced this, where you have a set of symptoms, you go see the Western doctor, and the doctor runs a bunch of tests on you, and then you go back to see him or her, and he or she would say, oh, all your tests are normal. You must be under stress. Maybe you're depressed. And then maybe there is a referral to a mental health practitioner, or maybe a prescription for an antidepressant or an anxiolytic, and you're kind of frustrated because you know that's not the problem. But this kind of frustrating experience can be attributed to the philosophy of Descartes. So the Western approach is analytical. They break things down to the very minute elements. And it's targeted. The treatment is targeted because most of our drugs are fighting something. They're anti this, anti that. inhibit this, inhibit that, antibiotic, antidepressant, antihypertensive. So it's a targeted treatment so that there's not much fallout because you don't want side effects. Now let's compare these two approaches. What are the differences? The Western approach focuses on disease. What is attacking the patient, and how can we fight what's attacking the patient by attacking the disease? Eastern medicine has more to do with not just what's attacking the patient, but how can I improve that patient's loss of balance and restore his ability to fight his own disease. Western medicine is analytical. It takes things apart. Eastern medicine is integrative. They try to put things together and make sense of it. Western medicine is specific. If they can't find what's wrong, they can't treat it. An example would be infectious disease like HIV. People were dying left and right, and until they found the HIV virus, could not do anything. Eastern medicine is non-specific. They don't have to know. They just need to know which body part or which system is having the problem. And then they direct their treatment towards that particular system. Western medicine focuses a lot on structure. I'll give the example again of a digestive problem. The Western doctor would address it most likely after all else fails with endoscopy. And often the patient would go back to see the doctor after the endoscopy, and the doctor would say, oh, your endoscopy was normal. And the patient probably feels, well, if my test is normal, how come I don't feel good? Maybe they do not realize that what the Western doctor was looking for was a structural problem. Maybe was there an ulcer, was there a polyp, was there a tumor, something they could cut out or zap. If they don't find it, then it's functional, but in the Western doctor's mind, functional means there's not much you can do about it anyway, it's all in your mind. So they don't pay too much attention to it. And the treatments actually for Western treatment for functional problems are usually not that effective. Now, Eastern medicine, if you have a structural problem, don't go to a Chinese doctor because they don't believe in invading the body, so they're not going to zap it or cut it out. But if you have a functional problem, Eastern medicine is pretty good at addressing those. Now, we need to take into account when is it right to use Western versus Eastern medicine. We need to take into account that every disease comes in stages. Some diseases, the stages are very short. For instance, like meningitis. One moment the person is fine, the other moment he or she is at death's door. There are other diseases where the stages are very long, like degenerative arthritis, where it could take years before the joint is so worn out that it needs replacement. Or coronary artery disease, where the artery is obstructed at a very slow rate, like 1% per year. So far, because of what you already know now, that Eastern medicine tries to restore the patient's ability to fight his own disease, Eastern medicine works much better in early stages. If it's late stage or severe, Western medicine should be chosen. However, if the patient has total knee replacement, after the surgery, there is a recovery period that might be kind of long. And that, again, would be the time where Eastern medicine can help to restore that patient's function. Okay, let's go back to my initial slide where I said that 36% of Americans use complementary alternative medicine. And why? Well, patients say Western medicine can't treat certain conditions. And now, you know, they're right. And the doctors say they weren't very sick anyway. And they're also right. So how do you decide to choose Eastern versus Western medicine? I'm going to list some factors that help. One is the effectiveness of traditional Chinese medicine. I usually, when I saw patients, I use the Western diagnosis first and then decide. And sometimes I use them in an integrated fashion. I found certain conditions that Chinese medicine was very effective in treating. The other consideration always is when you consider treatment, you need to weigh the risk and the benefit ratio. If the patient has cancer, if they require radiation or chemotherapy, there comes with it, as you know, some very risky side effects. But also, there is the benefit that with that treatment, there might be a cure. Other diseases, like degenerative arthritis, if you use Western treatment with non-steroidal anti-inflammatories, like Advil, Aleve, ibuprofen, there are a number of risks. If you use it for a prolonged period, there could be increase in the incidence of stroke or heart attack, stomach ulcer, and kidney failure. So is the risk worth it for the benefit? I just read that usually NSAIDs, their pain relief is not consistently the same. The peak of the pain relief is 2 weeks. After 2 weeks, it declines. By 8 weeks of using NSAIDs, it doesn't work. Okay, so in this case, if you sought acupuncture, the risk is very negligible, but the benefit is definitely there. So the risk-benefit ratio is very important. The other is timing. As you recall from my previous slide, certain conditions are much better treated with Eastern medicine early. And this is the reverse of the Western thinking that often insurance plans will say, well, if you exhausted all the Western medications and approaches first, then you can have acupuncture, which is really totally the opposite of what really helps. And then you need to understand the Eastern and Western paradigm. They're very different, and each has its strengths and also their limitations. So for true integration, you need to understand both Eastern and Western approaches. And I talk about that more in my book, Optimal Healing, A Guide to Traditional Chinese Medicine. So I'm if you're interested in purchasing a book, my two friends in the front row will help you with that. And then I'll open the floor to questions if it is of a general nature. If you have a specific problem that just affects you personally, I will stay after to answer those questions. Thank you.
Okay, so I have a microphone, if I can turn it on. Do you see why it doesn't? Do you have a question? I don't think it's on, that's the thing. It's on.
Okay, thank you. Just have a question. For a lot of patients, choosing and finding a traditional Chinese provider is very, very unconventional. Sometimes by recommendation, but oftentimes it's not the same as finding a Western doctor. Could you comment on that?
Yeah, I find that one of the most difficult problems when people ask me about that. The reason I wrote the book was to try to maybe engage some Western trained doctors to study traditional Chinese medicine. So I'm at a loss for recommending, and all I can say is word of mouth. I used to refer to my former teacher, but he retired and then he passed away. So it's a very difficult thing to do.
Anybody else?
The January 2019 issue of National Geographic is devoted to advances in medicine. And there's a whole section, and a very good section, on traditional Chinese medicine, which was, I thought, quite objective. And it was neither for or against. Certainly, some of the Western researchers are looking into some of the traditional Chinese medicine approaches. For example, at Yale, they're studying something called bear bile. Bears are very interesting animals because of their hibernation. And bile from bears slows down metabolism. They've synthesized the active ingredient at Yale, and they've perfused hearts, and found that if a heart is removed from an experimental animal, which sounds gross to many of us here, the heart will continue to beat significantly longer if it's infused with bear bile. The bile used, another point that the article mentioned was that most of the doctors in China today are trained in Western medical approaches, which I thought was interesting. They may supplement their practice with traditional Chinese approaches, but I couldn't help wondering how many people would go first to a traditional Chinese practitioner rather than to a Western trained doctor, a doctor trained in Western approaches. I don't know if you can comment on
that. Yes, I can. And as I said, I think the Western view of trying Chinese medicine is usually if all the Western methodology doesn't work, right? But in actuality, there are some conditions that are very responsive early on to Chinese medicine. And that's what I discuss in my book. And sometimes I use them in an integrated fashion. If it's a very acute situation, I might use the Western medicine first, and then during the recovery period, use Chinese medicine. But it's just a different paradigm, and I think Western doctors kind of try to incorporate the TCM paradigm into their own paradigm, which makes it very difficult, such as what you're saying about looking for the active ingredient. Sometimes there are multiple ingredients in a formula and they're synergistic. but I tried to approach research centers about a formula that I've used very successfully for circulation problems. And nobody wants to touch it because the Western approach is you zero in on one element. So we will not do research on a bunch of different herbs.
Well,
So-
that's certainly true. Certainly with marijuana, there's more than one active ingredient.
Yeah, right,
Um,
right.
So different ingredients work in different ways. The pharmaceutical companies, I think, are looking at traditional medications from various cultures, for example, in the Amazon.
Yes.
And in Western medicine, they've been using, before the scientific approach came along, they were using empirical treatments such as digitalis
Sure.
from the foxglove plant, which was very good for congestive heart failure and edema.
Yes, right.
So there's a good basis for some of these approaches
Yes,
empirically.
right, right.
But the Western approach is to study it scientifically, to
Right.
see if the results are replicable, to see what the toxic levels are,
Yes,
and that kind of thing.
yes, right.
I think another thing that disturbs many people in the West is people in not just China, but other parts of Asia as well, who are interested in getting rhinoceros horn or tiger penis for fertility problems. And I don't know just how widespread that is, but it is an issue for these wild animals.
Yeah, environmental issues, yes, yes. Yes, the back. What happened to the lights?
Can you address the difference between needle acupuncture and herbal medicine, Chinese herbal medicine? How they're different or complementary or?
Certain conditions respond very well to acupuncture. Sometimes if I use one in conjunction with the other, the herbal medicine would add energy to the patient. As I pointed out, you know, there's an economics of energy. So often I would do it in conjunction, one in conjunction with the other. Certain conditions, especially musculoskeletal problems, are very treatable with acupuncture alone. I've treated a lot of women's health problems with acupuncture alone very successfully. So it just depends on the various aspects of the individual, what they need. Yes.
Well, as a kid, when I sprained my ankle, my parents would rub me with titachao, so that's Chinese medicine, right?
Yes, right.
It worked, I think.
Yes. Uh-huh. Yeah,
Everyone here,
you're right.
Did everyone hear?
No.
Would you repeat?
As a kid, when I sprained my ankle, my parents would put titachao and rub it, and black and blue eventually went away and got better.
Yes. So yeah, it's a herbal liniment that you apply topically, and it does seem to work. And I think a lot of it has to do with improving the circulation to the area.
Dr. Tsang, I remember something in your book you talked about with Western doctors being very interested in what scientific study might reveal. And you mentioned in there some of the difficulties in getting funding for Chinese herbs and acupuncture to demonstrate to Western doctors that they are effective.
Yes, I think some of it has to do with the profit motive. If you use natural treatments, you can't patent it. You can't make much money off of it. So there's no incentive to do a lot of research, with natural products. There is a big pharmaceutical lobby
Yeah.
that discourages.
Mhm.
And then they will say, oh, there's no scientific proof. But then to get proof, it's very difficult. So they say, there you are. See, there's no proof. So it's a catch-22 situation. But when I think back about the opioid epidemic, if more American doctors were trained and used acupuncture, it might have averted the opioid epidemic.
It's certainly true that pharmaceutical companies are interested in making money, there's no denying that. But an example of some of the research that has been done is with the Indian drug, which was extracted from the Rauwolfia root, Rauwolfia serpentina back in the 50s. They extracted reserpine, which was effective for hypertension and for schizophrenia. Unfortunately, it produced a large, it tended to produce depression in many patients, so it's not successful over the long term. But they do research, and they're looking for the profit motive business, no question about that.
Yes, they modify it so that it's a synthetic.
Yeah,
Yeah,
right.
that's.
It's fairly easy to synthesize a drug once they identify it, as the Yale doctors did.
I'm just curious if, is there research on Chinese medicine done in China? I mean,
That's a good question. I don't claim to be authoritative on that. I don't know. There used to be a journal of Chinese medicine where it seems like they were doing research, but also how reliable, that's the other thing, because maybe there's not that much oversight, so it's hard to tell.
Any other questions?
I just want to say that over the years, I have had quite a bit of acupuncture. I've not done any herbs, Chinese herbs, but I have had acupuncture for all kinds of things, and I am a big fan. So I am an advocate of acupuncture.
One of the takeaways for me from the book is that in Chinese medicine, they're looking at the person first to see what might be out of balance. Whereas I was very interested in your analogy of the Western medicine looking at us as machines. This part needs replacing. This part needs lubricating. And I have found that in situations that I have had with Kaiser doctors. All right, thank you so much. It's been a pleasure having you. Thank you.